The Orange Democratic Party has proposed the elimination of all forms of lockdowns, curfews and travel restrictions. In a notice of motion in Parliament, the party wants less stringent yet equally effective containment measures. This owing to the devastation of the economy and massive job losses witnessed here. However, health experts warn that the pandemic is still not yet under control. And as Dorcas Wangira reports, the last week saw the highest weekly number of tests reported by the Ministry of Health, with the national test positivity rate in the last 10 days ranging from 9% to 17%.
During the fifth session of the 12th Parliament,
Mr. Speaker, they're aware that the COVID-19 pandemic...
An Orange Democratic Party-sponsored notice of motion signed by the leader of Minority Party, John Mbadi, and the Mvita Member of Parliament, Abdul Somad Sharif Nasir, proposed the rollout of COVID-19 measures. This owing to the devastation the COVID-19 pandemic has and continues to cause, as exemplified by the massive job losses, unprecedented layoffs and underperforming financial market, global trade and general strain on medical facilities countrywide.
Equally, Mr. Speaker, deeply concerned that the frequent lockdowns instituted by the executives with the objective of countering the spread of the pandemic are a key cause of the underperforming economy despite the noble intention behind their implementation. Further aware that the current unprecedented challenges call for extraordinary but necessary solutions, this House, therefore, urges the national government to roll out a COVID-19 economic stimulus program that incorporates an enhanced Kazi Mtaani concept in urban areas.
The enhanced Kazi Mashambani concept in rural areas should enhance cash transfer packages to the elderly, orphans, the vulnerable and the destitute, eliminate all forms of lockdowns, curfews and restrictions, and replace them with less stringent yet equally effective and economy-friendly containment measures, including provision of PPEs, sanitization protocols and roll out a mass vaccination campaign that includes restriction of access to work premises by non-vaccinated employees, among other similarly effective interventions to stimulate economic recovery and national growth. However, this puts the country between a rock and a hard place, having to strike a balance between lives and livelihoods. According to the Africa Centers for Disease and Control, Africa CDC, August 5th, Kenya has already entered its fourth wave.
And 3 countries are actually experiencing a fourth wave. That is Algeria, Kenya, and Tunisia. The situation of the variants has not changed much since last time we briefed.
Even though the Ministry of Health has not officially declared this, citing that Kenya did not come out of the third wave yet, having failed to sustain a test positivity rate of below 5% consistently for 14 days, as recommended by the World Health Organization, before any significant restriction of measures. The ministry saying that the country experienced peaks and troughs of this wave instead. However, the last week of August saw the highest weekly number of tests reported by the Ministry of Health, with a test positivity rate ranging between 9% to 17% amidst increasing testing. This, according to Dr. Ahmed Kalebi, suggests that we are likely approaching the peak point of this COVID-19 fourth wave if no more super spread activities take place this month. Likewise, the next 2 weeks, as the cold season edges to a close, will be key in determining whether the fourth wave will accelerate out of control, depending on how the Delta variant intensifies in Nairobi and neighboring counties and spreads to other previously less involved counties.
There's no opportunity for relaxing. We have seen countries that have very high vaccine coverage, including Israel, that they relax protocols for a long time, and then we start having pockets, simply because the virus is still around. And we may have people who are still vulnerable in our populations, and those will still be people who can easily get severe disease.
In the last 24 hours, 1,183 more people have tested positive of COVID-19. From a sample size of 8,144, the test positivity rate is 14.5%. Nairobi recorded the highest number of cases, 442, 4 times the cases recorded in Nakuru, 91, Kiambu, 85, Mombasa, 76, and Kilifi, 58. 1 death occurred in the last 24 hours. 31 late deaths were recorded, bringing the fatalities to 4,211. 1,827 COVID-19 patients are admitted in health facilities countrywide. Dorcas Wangira, Citizen TV, Nairobi.